and Assalamualaikum. I'm Nurfar Mafuza from HK3. Will present about one of the male fertility problems, which is oligospermia. So let us start. Oligospermia is a term that refers to the condition where there is a low concentration of sperm in semen, and it is a common condition in male infertility problems. In 2009, WHO stated that if the sperm count is less than 50 million sperm per milliliter, then the condition is called oligospermia. There are three categories of oligospermia, which is mild oligospermia, moderate oligospermia, and severe oligospermia. There are several methods applied by experts to diagnose oligospermia, like semen analysis, scrotal ultrasound, hormone testing, post-ejaculation urine analysis, genetic test, testicular biopsy, anti-sperm antibody test, specialized sperm function test, and transrectal ultrasound. Among all these methods, the primary diagnostic test for oligospermia is semen analysis. Basically, semen analysis concentrates on the volume and quality of a man's sperm by collecting semen sample and evaluating it in a lab. Furthermore, it is the first step to detect male fertility problems before another step comes. That's why we assume semen analysis as the primary diagnostic test for oligospermia. A man will be diagnosed with mild oligospermia when the sperm count is between 10 to 15 million sperms per milliliter. Moderate oligospermia when the sperm count is between 5 to 10 million sperms per milliliter, and he also can be diagnosed with the severe oligospermia when the sperm count is between 0 and 5 million sperms per milliliter. That is why probability for one of sperm from men with oligospermia to fertilize an ovum is lower than men with normal sperm count. However, men with oligospermia are still able to be father of a child. The production of sperm is a very complex process as it involves the normal function of testicle with the hypothalamus and the pituitary glands, which produce hormone that will stimulate the production of sperm. Malfunction in any of these systems can affect the sperm production. However, there are a lot of causes that may contribute to the oligospermia to happen. Thus, we divided all the causes into three, which is medical causes, environmental causes, and the health and lifestyle causes. One of medical causes that contribute to oligospermia is varicocele, an enlargement of the veins in the scrotum. Developments of varicocele in scrotum can block the blood flow to the reproductive system. Scrotum is the sac that containing testicle. As a result, blood pools occur in the scrotum and the vein becomes abnormally large since the blood cannot return to the heart through this vein. This can decrease an individual's sperm count. Besides that, ejaculation problems such as retrograde ejaculation, which is the entering of semen into the bladder during orgasm instead of emerging out of the tip of the penis. Thus, the ejaculated sperm count is lower than normal level, which can be diagnosed with oligospermia. Instead of medical causes, sperm production also can be caused by overexposure to certain environmental elements, such as radiation or X-ray. In other words, we can say that exposure to radiation can reduce sperm production, and it takes several years to back to the normal sperm count. However, sperm production can be permanently reduced with high doses of radiation. Then, daily consumption of alcohol, also can cause oligospermia as it lowers the testosterone level, thus, the production of the sperm decreases. There are various of clinical treatments to treat oligospermia, and one of the treatment is surgery. For instance, the surgery to remove varicocele, which is known as varicocelectomy. Varicocelectomy is a surgery performed to remove enlarged veins. This is done to restore proper blood flow to reproductive system. Laparoscopic varicocelectomy is the most common procedure performed by surgeons in which they will use several small incisions and a laparoscope with a light and camera to see inside of an individual body. But they might perform an open surgery which a large incision is applied to allow them to see inside of an individual body without a camera. Instead of clinical treatment, oligospermia also can be treated with other alternative treatments. Interestingly, many herbs have shown their specialties to increase sperm count. For instance, consumption of ashwagandha or Withania somnifera, which is a medicinal native herb to India that has been used for 1,000 years. Most of beneficial properties and preparation come from its roots. Based on CNY Fertility article, a placebo study of 42 men showed that by consuming 675 mg of ashwagandha per day for 90 days, had increased key fertility measures in men with low sperm count. As a proof, the sperm counts increased by 167% in 90 days. However, such improvements were not detected among those who received a placebo treatment. Thus, consumption of ashwagandha is recommended as alternative treatment for men with oligospermia. Moreover, ashwagandha can be consumed in such many forms, which is tablet form, capsule form, and in powder form. Therefore, they can choose which form are the most comfortable for them to apply on when consuming the herbs. That's all from me. Thank you.